But what I do want to do is talk for a few minutes to you guys about coronavirus and what's happening in our country right now in our society. So we'll get into this, but the short order is that cases are spiking right now, and it takes about 3 weeks from the minute you intervene when you have a rising microbial outbreak to be able to return it to a base level, as we'll see. When I say 3 weeks, it has to do with the specific nature of this virus. But what I mentioned at the beginning of class is that in the next few weeks, we probably will see numbers start to crawl much higher. And so I want you guys to be prepared, understand why, but also realize that there is a way out. There will be hope through all of this. Okay, so not to be too dramatic because the future is still unwritten. But when you have infectious diseases, we usually talk about morbidity, which is the sort of long-term damage or complications. We talk about asymptomatic transmission, right, where somebody can be a carrier for a disease and transmit this in some way where they're not symptomatic and not showing short-term complications or long-term, we call acute conditions, short-term or chronic disease side effects or morbidities. So asymptomatic carriers can be very challenging when you have disease transmission. Also, when a bacteria or virus or a fungal infection, whatever it might be, when you have levels of contagiousness, okay? So some microbes are much more contagious in their spread than others. Some occupy and can infect many different animals. We call those zoonotic microbes. Think of like a zoo, and that's where you have common structures. So you have zoonosis, you have asymptomatic transmission, you have contagiousness, and coronavirus sort of encapsulates the worst of everything in that it is a respiratory virus. If you look at human to human transmission, you can get direct contact either from shaking hands, right, or breathing. Indirect contact with what we call fomites, where you can pick this up off a doorknob and move it through what we call the triangle of death, right, where most of your microbial infections come, your eyes, nose, and mouth, right? Droplets. We know that coronaviruses pass not just through respiratory droplets, but little mini droplets called aerosols. So it's airborne. And we also know that it can pass through the fecal-oral route. So what's fascinating is a lot of microbes, bacteria, viruses that you would shed would cause digestive tract infections, cause the animal or, to have bowel problems or initiate diarrhea to get itself into the environment so another organism could carry it. So these are all adaptations of microbes. It's usually either respiratory or sexually transmitted, membrane to membrane, blood to blood, through a bite or a sting of a vector microbe or vector animal, which can carry the microbe but isn't necessarily infected by it, and to the fecal-oral route. Turns out they're determining viral loads now by looking at raw sewage, and you can see by the amount of coronavirus in the excrement rolling through the sewers what proportion or make an estimate as to how prevalent it is in a city or in an area. And so coronavirus is sort of the perfect bug if you wanted to make a microbe that doesn't kill the majority of its hosts, is highly contagious because it's respiratory, that is transmitted 2 or 3 days now before you show symptoms, unlike with other colds or influenzas where you tend to be contagious once you're sniffling or once you're coughing. This is passed in healthier carriers for days before the carrier knows that they've had it. Again, it's very highly contagious, as we're realizing, though it does look like that masks can interrupt this. It also looks like that when you're outside, if you maintain certain levels of distancing, you can prevent much of this. So masks and distancing are important. But we've also have evidence now that the respiratory droplets that this microbe is carried in, if you breathe, it's about 3 or 4 feet. If you cough, it's 6 feet. And if you sneeze, it's 26 feet in which these aerosols can reach another carrier. So it's sort of the reason why this virus is the one that's become pandemic, is because it's moving through a lot of healthy hosts. Okay, so it doesn't cause morbidity, it looks like, or symptoms in about 1/3 of people, mostly young. As you get older, you tend to see more of a progression of symptoms. What's other So it's transmitted that way. You have a lot of healthy hosts moving it around. You have delayed onset between a week of symptoms after you got it 3 or 4 or 5 days before that, a week or two of symptoms. Then if you see hospitalization, another week or two before, if people need oxygen or go on ventilators. So this is very good at transmitting, and it looks like it kills anywhere between 0.5% and 1% of people. But it also looks like now, and we're learning more about this, that 1 in 10 people that come in contact with this and carry the infection develop long-term symptoms and complications, so morbidities. This is everything from swelling, shortness of breath that can last weeks to months, liver damage, kidney damage, scarring of the lungs, and also now brain damage, we're realizing. One of the symptoms is loss of smell, and it's probably because it infects the olfactory neurons, but we're finding now that this can cross the blood-brain barrier and go into the brain. It also attaches to endothelial cells on blood vessels. And so what we're finding are chronic inflammatory responses in people, even after the 2 weeks where they've cleared it. Though it appears not to be contagious after the 2 weeks sort of shelter in place or isolate situation. Okay, so the basic reproduction number. Different viruses or bacteria have different rates of infectivity for carriers. Flu, these are called reproduction number. So a reproduction number of 1 means for every 1 person that carries it, 1 additional person gets infected. It's called the R naught, or the reproductive ratio. If you have influenza, on average, 1 to 3 people are infected from every 1 carrier. SARS, Ebola, it's 2. Plague was 1.3. Avian bird flu, less than 1. Measles is among the most contagious viruses. Every 1 person that carries this, on average, infects 16 other people, right? And so these tend to be the respiratory viruses are the most contagious. And if you want to bring an outbreak under control, what you have to do is get the R naught below the number 1. Because what that means is for every 1 person that carries it, right, less than 1 person is going to contract it. And so you can think of an R naught. Let's say the R naught is 0.7. This means out of 10 people that carry avian flu, 7 people will catch the flu from those 10 people. So it's not a 1-to-1. But what I want to impress upon you, and you'll be hearing about this in the media, is we got to flatten the curve. We got to break the cycle. When you flatten a curve, what this is basically saying is you've brought the infection rate from going like this, now it's starting to flatten. The infection rate when you've flattened the curve is 1. So for every 1 person, you get a transmission. Now, coronavirus, okay, is nasty in that we don't know what the R naught is. We know that some people spread it to 1 person. Some super spreaders spread it to 15. We've seen church congregations where 1 person had it. They're all singing carols for 3 hours, and then 12 or 14 or 25 people have it. It looks like it's much more environmental. It's much more indoor, close proximity. And if you're yelling or singing or projecting your voice, what's happening is you're shooting virus everywhere, and people are much more susceptible to contagion. So the R naught, right, how many people are going to pass it to who, is much more difficult to assess. Carriers have much degree of variability. And it looks like healthy people are super spreaders, people that don't develop symptoms at all. We don't know why that is. But we also know that people that travel a lot, go in big groups, are super spreaders. So it's not everyone with coronavirus passing it to 2 or 3 other people. But on average, it looks like for every 1 person that has coronavirus, on average, you have an R naught of anywhere from 2 to 4. So that means for every infection, you have 2 to 4 other people that are going to have this. Okay, so I want to just show you something about spreaders here. So this is about cutting the link of transmission. I really like this figure because it shows if you start with 1 person, and let's say the average R naught coronavirus is 2 people that would become infected in the 5 days ago this person got the infection. They're going to develop symptoms 3 days from now if they're in the 2/3 of people that will have symptoms. So there's 3 days before this person in red is sick. Over that period of time, 3 days from the 5 days the virus has been replicating in the nostril, and this person's breathing it out, but now you have enough of a viral load in the nostril that's already now moved into the lower respiratory tract and is being aerosolized by this person 3 days up to before they show symptoms. On average, 2 people will catch the virus from them. Now remember, the average, most of this is super spreaders, and so there are fewer people that are spreading to a lot more. But what you can see is you can interrupt transmission when you have contagiousness, where you can have doubling times of several days. It looks like when nobody's wearing masks and nobody interrupts this, the average number of days it takes to double the infection, so one person to pass it to two, is about 3 days. So that means you have one day, one person. Day 3, you have 2, right? Day 6, you have 4. Day 9, you have 8. So coronavirus can do this nasty thing where it can pass for weeks, 3, 4 weeks, where you're getting 2, 4, 8, 16, 32 every 3 days. You do that, 3 to 4 weeks of nothing, it appears, right? Several hundred people or 1,000 people in the population. Now you double 1,000 to 2,000 to 4,000 to 8,000, right? Every 3 days. Every 9 to 10 days, you can go from 1,000 to 10,000. Every 9 to 10 days, you go from 10,000 now to 100,000. Every 9 to 10 days, you go from 100,000 to 1,000,000. And so what you see is this looks like it's not causing any problems until within 2 weeks, you go from thousands to millions. That's what we're dealing with right now. After Labor Day or Memorial Day, everybody's just out and about, sick of sheltering in place. Really, virus doesn't look like it's anywhere. It's hidden. And so it feels fine. And you go 3, 4 weeks through June, which we've spent together, where it doesn't look really bad. And now in the last week of June, we're starting to see spikes because we've made it through this doubling time enough cycles. Such that April 1, right, the number of cases hit a record high of 30,000 per day. We sheltered in place from mid-March to about beginning of June, right, Memorial Day here. And then you have several weeks of 20,000 cases, and now we're spiked up to 50,000. Okay, this was the day before, I think. Oh, no, that's it. So you can see in some areas, sorry, my head is in the way, but in some areas now you have up to 50,000 cases. And this jumped, guys, from 20,000 to 50,000, right, in 2 weeks. So this is showing you here, it looked like nothing, 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 and then a whole hell of a lot, because we have moved through that 4-week cycle. And so that's what we're seeing now. New cases reported. This was yesterday, 45,000 cases. New York Times. This is today, 50,000. So you can see, right, if we're in this area here, and I'm sure some of you guys are horrified at this moment, we're somewhere in this phase, right? If we're going from 45 to 50 to 100,000. So we're right here. And that's what we're starting to see, as you will see, this rapid increase where it doesn't feel like it's really bad until it is. We now, as of today, we're at about 50,000 cases a day. You can see we're roughly 2/3 past where we were at our worst moments in April. But the good news is we can interrupt this, okay? And the way that we interrupt this is cutting the chain with masks. So notice here, if you go from 1 to 2 to 4 to 8 to 16 to 32, and this takes roughly every 3 to 4 days to happen if you have no mitigation. If you socially distance or wear the mask and you avoid even one person at that very beginning, right, you interrupt over several weeks' time hundreds or thousands that would have caught the infection from you if you happen to be carrying it, even if you were healthy. And so by wearing the mask, by socially distancing, you can see how every human being matters when you go several weeks. We're 2 or 3 years away, most likely, from an effective vaccine. But if people socially distance, wear the mask through whether it's this month or next month or 5 months from now, every human matters. Because if they have it, look what happens within a month. Okay, any questions on any of that so far? Okay. It's not all grim. Where masks aren't required, virus cases have gone up, risen by 84% since we stopped sheltering in place. In places where people are wearing masks, the number of new cases have fallen over 2 weeks. So huge differences. What we see is that masks reduce airborne transmission. And I mentioned how they're different size aerosols, right? So you have respiratory droplets that are very large, and then you have these mini aerosols. Now, these all pass 3 distance on average. If you breathe or sing or yell, 6 to 9 feet. If you sneeze, 26 feet. When you are wearing a mask, what you're effectively doing is you're lowering by 9 or 10 times the amount of large and to small aerosols that pass through. The aerosols are going to get through more, but they're going to diffuse while they do that. So if somebody else is wearing a mask, right, they're being protected somewhat, but they're doing more protecting than being protected. So if this person wearing the mask has the virus and this person doesn't, you can see how much more of a viral load, how much of those little aerosols that can pass through masks get in. And so this is why you are your sibling's keeper on this, right? You wear the mask for them, they wear the mask for you. It's social responsibility. And what we find is if 60% of people are wearing masks, 60% of the time, one of these people are eliminated. So you get to this point. If you're 80% mask wearing, 80% of the time, both of these block. And so what you do is you get below an R naught of 1. And so what we've seen, flattening the curve, right? If you do nothing, you just let it rear out of control. 1% of population dies. 10% lives with probably chronic morbidity and doesn't realize it yet because it's new and this research hasn't emerged as much. If you flatten the curve sooner, this is the other thing. Let's say we get back to a point where instead of being in this exponential growth, where we, as Anthony Fauci has said yesterday, this is, by the way, where he's saying, guys, we're going to be at 100,000 cases per day, and this is going to be awful. He said this yesterday to Congress. The reason why he said that is because, right, we are in that period right now, we're at about 50 new infections per day. And so you can see how 3 to 6 days of doubling time that way, by the end of next week, and this is why I'm a little upset and hopefully not terrorizing you guys too much here, but this is why I'm saying it's about to get really bad. Because if this has a doubling time of 3 to 4 days, you go from 50 to 100 new cases every day. We could be seeing that by the end of next week if things don't change rapidly. All right, so I'm sure that's scary as hell. The death rates have been going down, but I want you guys to get a sense of what happens. Reported US coronavirus deaths in March. Talk about, can't believe how much we've lived already. 2 deaths March 1st. We left campus March 12th, right? April 1st, 4,000. May, 64,000. So this gives you the sense of exponential growth, right? You go from 4,000 to 64,000 in the period of a month. And this had to do with us sheltering in place, right? We were already at home, but only about half of people were actually doing this around the country. So we still saw growth, but not the way we were expecting to. People stopped sheltering in place towards the end of May, so that shelter in place got to catch up, and we had flattened that curve you had seen probably, right? So by sheltering in place, where's my curve here, for a month, 6 weeks roughly, we had flattened the curve and started to bring it down in some place of the country. But for the most part, we opened up here, or on the slow decline. That's why you see in the end of May, right, where we're still starting to decline, but our curve is it's still declining, but it's pretty much flat. We didn't do this long enough. And now within a month, you're seeing nearly a doubling of what we saw before. So this is important to think about. May to June, right? Not nearly the growth that we saw in April to May. It's about the same. But now from June to July, it's slowed down a bit because we sheltered in place. But now we're going from July to July 15th, where we could see this number go up by like a third. Okay, so there is some good news here. The good news is that the deaths are not rising as much. If you look, even though the number of new cases are rising, the death rate is lower than it was before. And that's what we're seeing here. So you can see a curve, we're saying, okay, well, fewer and fewer deaths, that's a good thing. But what's happening, as we talked about before, most of this is the fact that you're shifting the demographic from old people who are afraid to go out and nursing home residents that died. 40% of the total deaths were nursing home people. So we figured out how to protect them. The older people are not staying at home, are not going out. So you're seeing a much higher number of healthier, younger people catching this. So this is why you get this confound of the number of cases going up profoundly right here, right? We're actually here, while the death rates here are dropping below 1,000. However, what we're seeing now is that nationally, this is starting to change. And this is because it's got a 2-week delay with the number of cases typically. Because what happens is when you have more people spreading this, it takes about 2 weeks for hospitalizations. And so that's what we're starting to see. And so even though the numbers are going to look high here in the next 2 weeks, in the next 3 to 4 weeks, we're going to start to see the number of hospitalizations and deaths occur, because hospitalizations precede deaths by about 2 weeks, and we're starting to see that rise now. Okay, I've thrown a lot at you guys, I know, but I just want you to be aware of what's happening here. Of the 10 million confirmed cases in the world, there have been 500,000 deaths. So it looks like the rate is about 5% or 0.5% globally. The United States has 1/4 of the world's coronavirus cases. So if you look at Brazil, India, US, UK's reducing, Mexico's high, but US, Brazil, India, and UK are the most hit right now. There are only 4 states, well, 3 states in DC where the cases are dropping. There are 9 or 10 where they're stable. These are all the states where the coronavirus is rising. And in the green, or in the dark red, this is over the last 14 days. So you guys know exponential growth does not look bad until it looks really bad. And that's what we're seeing now. So if you look at Florida, right, this is from June to July. Look at the last week. Florida is a hot spot. If you look at, what is this? Oh, I mentioned Arizona, another hot spot in the Sun Belt. Cases have gone up like 3-fold in the last 2 weeks because they're on that later part of the curve. This shows the hot spots here. Texas, same deal. Interestingly enough, the Texas governor who said don't wear masks just today made it a state rule to wear masks. But this is after now infections have tripled in that time, in the last 2 weeks. And then in California, we've had more cases and more deaths, but we have 1/10 of the country's population. And if you look at who's being affected in California, it's LA County, Imperial County, really just people of color. Large measure of this, people that work essential jobs, low-income folks that can't shelter in place, that can't separate or quarantine when they live a bunch to a family. And so we're starting to see hotspots emerge this way. But look at California. As the California cases have gone up since mid-March, the Bay Area, which was the first place in the country to shelter in place mid-March, and has basically mayors and county officials, public health officials that have maintained some of the strictest shelter in place. And Bay Area residents have been among the most, say, proactive at sheltering in place and taking precautions. our infection rates are way lower than the California average. Look at this. The European Union, in a matter of 2 months, is able to drop their cases to virtually, a tenth of what it was, whereas ours barely dropped and is now going higher. So who you vote for matters. We have a way to do this, though, to fix this. And so testing, contact tracing, PPE, cases, and helping with the hospital system is important. But again, just to sort of round this out, based on where you've seen on the curve, we are currently 2.5 million people have been infected. We know that the actual count is probably 8 to 10 times that. Okay. The way we know this is you take 10 people at random who are not at the hospital or getting a test, and you just test them. And when this has been done around the country, it looks like 9 people test positive that didn't know they were carrying it at the time, and then maybe go on to get sick. So I'm sorry, 1 person out of 10 gets tested for this and has it, but what you find is typically it would be less than 1 in 100 or 200 that would have this. So if you do random sampling, you see that roughly 1 out of every 10 people in the country, or 1 out of every 12 people, have virus positive tests. So what this means is that of the 2.6 million people in the US that are currently infected, with 50,000 new infections every day, which in a week or two will be 100 or 120,000, it's probably about 10 times that amount. And so what the CDC is saying is it's about 26, 27 million people. That's about 8/10 of the country's population. More of them are young and healthy, but they're super spreaders. And so when Anthony Fauci says, if you just look at how the virus works, and it has its doubling time, as it does, in the next 2 weeks, we could hit 100,000 cases a day. And what you're seeing there is only 1/10 of what's probably happening. Okay, that's scary, but what we're seeing now is that people are sheltering in place. Even the most intransigent of leadership are asking people to wear masks and mandating it. So if we interrupt things now in the next week or two, we can bring that down. But what we're going to see is a lot more pain, right? Probably up to 100,000 cases a day. And what that translates is roughly a 3 to 4 week lag between what we see here. So it's estimated that we will probably hit about 200,000 dead. We're at 128,000 now. 200,000 dead by the time we hit fall, based on the way we have not managed this. We were hoping it would be much less, but that's where we probably are going. So please be safe, be careful, and take care of each other, and make sure you and your family are wearing those masks, doing the distancing, while the rest of the country and people around you figure this out. Because within the next month or two, you're going to see a lot more of this than this.